The South African Society of Psychiatrists highlights the role of work in stress and mental health, stating that good work can improve mental health and enhance treatment access. Depression is a leading cause of disability and ill health globally, costing the South African economy 232 billion rand annually. A member of the South African Society of Psychiatrists, Dr. Siki Mdletye, joins us now to expand on the conversation. A very good evening to you. Thank you so much for your time. Depression coming out very strong, the leading cause of disability and ill health globally. I mean, does that figure come as a surprise as we try to scrutinize the role of work and mental health on individuals?
So thank you very much for having me, and good evening to your listeners. You know, that number, although it is absolutely alarming, you know, comes as not too high a surprise if we consider where we are coming from. And by that I mean coming out of the COVID pandemic, being in a situation where there's a lot of instability, where you know, there's high unemployment, and where there is where people are employed, where in their workplaces people face a tremendous amount of stress and struggle in general to cope. So that number is very high, very alarming, but perhaps not too much of a surprise.
We're also looking at, just breaking down the numbers, 52% of employees surveyed have been diagnosed with a mental health condition. Depression coming at 32%, stress at 25%, 13% burnout, 10% trauma. What does this reflect as we take a look at the day-to-day lives and the workplace, and whether it be working from home or perhaps working in the office, as you make mention of COVID-19 and the impact and some of the ripple effects we saw?
Yeah. So what the numbers kind of tell us is that South Africans in general, but South Africans in the workplace, you know, face a lot of, you know, stressors within the workplace that negatively impact the mental health. Another thing that the numbers tell us is that the workplace, in fact, this is not what the numbers say directly, but this is what we would like to suggest really as a way forward, because of the fact that there's a high rate of mental illness. You pair that with the fact that there is a high rate or a high treatment gap for mental illness. So what that means is a lot of people that have the mental illnesses are either not diagnosed, or if they are diagnosed, do not access the help or the treatment soon enough. So that high treatment gap is estimated around 75%. And that kind of places the workplace as something of an ideal locus or an ideal space wherein the mental health needs of people who are either undiagnosed with mental illness or people who are just simply plodding along, right? Coming to work every day, disengaged, maybe burnt out, but showing up in the workplace. And a lot of that we see in the high rates of presentism, right? People who struggle with mental ill health, but who are showing up in the workplace, who are not performing in the workplace, who are costing employers greatly, almost you know, double what absenteeism is actually costing employers, but who are showing up nonetheless. So we're saying that this actually creates an environment where the workspace is very ideally placed to be, firstly, where screening, where early detection can occur, where early or sort of first aid level interventions can occur, and where referral to help can be highly impactful or highly effective. So yeah, so we think the workplace is actually quite well placed to play this role. Another way in which the workplace then becomes ideal is in the fact that interactions between people in the workplace occur almost methodically. You know, sometimes there's performance appraisals, and slowly you see, you know, someone disengaging from the workplace, not performing as well as they should. And in a context where there isn't a skills deficit, where someone was employed on the basis of them being appropriately skilled for that job, however they're not performing, right? So we're saying that these are opportunities in which mental illness can be picked up if, you know, people within the workspace are adequately upskilled and are able to identify when there are issues and where early intervention can occur.
What role can the employer play in terms of making the tools accessible for one to be able to get this intervention? I mean, it's all well and good for you know, for one to acknowledge or see that a colleague needs help. Then what?
Okay, so I think this is a big part where education matters, right? Where upskilling matters, because you know, being able first to even identify is a skill within itself, right? And one needs to be deliberate about learning how to identify these. Then what role can one play? So as I said, an investment in mental health within the workspace goes beyond just the employee who is affected. So in a lot of workplaces, you'll find that there are employee assistance programs or mental health and wellness you know, services, whether it's EAP or employee health and wellness. So when people within the workspace are able to identify that someone is struggling, they can direct them to these EAP services, because that actually tend to be quite underutilized, right? And this is concerning because you would expect that there would be good utilization or uptake of people into these kind of programs, but we're finding that they are very often underutilized. So what I'm saying is, when you know, a colleague or a leader, a supervisor, manager identifies that, you know, this employee could potentially be struggling, the conversation could literally be as simple as to say, listen, you know, I've noticed that, you know, either you're missing work on Mondays, that you're struggling a little bit, you're not meeting your targets, and sort of would you like to talk to someone, you know, and then direct them towards the services. In workspaces where these services are not available, you know, there's always the option to refer to a local clinic. There's always the option to make use of free helplines like South African Depression and Anxiety Group. But the fact that people are in the workspace for most of their waking hours makes it an opportune environment in which, you know, this kind of early detection can occur, and referral to help can you know, improve the outcomes, improve the prognosis.
Very well. Thank you so much for that intervention there. Weighing in on the discussion, Dr. Siki Mdletye, who is assessing as we take stock of World Mental Health Day.